Everyone, and welcome back to my channel, Dr. Coco's Medmonics. I debated on whether or not to do this video for a while now, just because it is a little personal, but at the same time I think there's so many people out there who were in the same boat as me and really needed some motivation to help them keep going. Before I get started, I'm an MS3. I can't really tell you about how this is going to affect me as far as match goes because I don't know. And I understand that a lot of people were worried, like, I failed step one, am I going to match? But to be honest, I'm not trying to think of that right now just because I know people who, killed step one and they still didn't match. And then I know people who failed step one and they matched. So it's just such a weird system. So don't think about that now, but if you were a person who failed step one and you're like, what do I do next? Like, do I quit? Do I go back? Like, do I take it again? What do I do? Maybe this video will help you, and maybe this will give you the motivation to keep going. And I wish that somebody had done a video like this when I had failed. So yeah, this is one about, I failed step one, and I not only came back, but I came back and I did really well the second time. And maybe this video will give you some pointers. But first, make sure you have time to grieve. I took about a week of just me like crying in bed, being upset. I failed step one by like 1 point. And I literally just kept telling myself like, oh, you're stupid. Like, why did you do that? And that's not productive. Like, it's easier, said than done. But make sure you take time to grieve, especially if you're a person like me who failed it during this COVID time and honestly like trying to learn medical school online sucked, and then trying to take steps sucked, all while in this pandemic with family loss and all of the craziness that's been happening. Make sure you just take time to grieve, take that time to say like, wow, this sucks. Use this time as if it was a loss in your family, and you wouldn't tell a patient like, oh, well, I'm sorry that you lost your husband, just get back out on the horse. Like, you wouldn't say that, so why would you say that to yourself, right? Next, make sure to take care of your mental health, because this process, it really sucks. And on a personal level, I did go and seek some help for my mental health after this. And I don't regret it at all. I had a physician who was like, I had a lot of friends that went through this, and they're my colleagues now. Like, failing step one is not the end if you can take your failure and, put it towards being a better doctor. Channel that grief into another emotion. After my week of grieving, I just got mad. I was so pissed. I was like, how dare I fail this test by one question? Like, that is not representation of my knowledge. This is not the way I studied. I did not, fail a ton of MBMEs. Like, I had been passing, I'd been doing well. What the heck happened? So take that emotion and, get mad, get that motivation to keep going. And then know that you can't change the past, but all you can do is like slate your future. And I love RuPaul. RuPaul's one of my favorite people in the world. And RuPaul always says, you better work. So we're going to work for our future, right? So how I kind of changed my study habits. So I used to think, oh, you have to, read first aid. I'd gone through first aid like 3 or 4 times. And I was like, oh, I know it. But like, do you actually know it? Probably not. The only way you can know it is if you apply it. And so many people say, oh, well, I have to do my first pass through first aid. I have to do my second pass through first aid. No, fuck that. Don't do that, okay? That is going to be a waste of your time and a waste of, honestly, you're not going to learn, to be honest. So take what you've learned from your first 2 years and put it into question stems. While you're doing questions for studying, that process is going to be different than when you do questions to practice for step. And so if you're doing questions for studying, I would do about 40 a day. And that doesn't seem like a lot because I know that people on Reddit will do like hundreds upon hundreds of questions, but I think that doing hundreds of questions is not the best use of your time. So when you're doing questions, say 40 a day or however many, I would go through every question as if this was a patient in front of me. So you have this question and you're like, oh, blah, 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 blah. But are you actually thinking about when you're in MS3 and you have a patient in front of you? No, you're thinking about the stupid test. And that's not the way we should be thinking, right? So you go through this question, and while you're studying, obviously give it an answer, figure out if you got it right or wrong. But then you go through and you figure out, okay, the demographic of this patient, this is a 65-year-old man normally, or this is a childhood disease. You have this demographic of this patient. Is it more likely in Caucasians, African Americans, things like that? Make sure you think from the top to the bottom. You go through the symptoms that they would have. Does the question stem give you the symptoms? Are those the normal symptoms, or are those weird ass symptoms that NBME pulls out of their butt sometimes? I don't know. So you go through all the symptoms that they have, the symptoms that they would normally have, maybe the ones that they didn't put in that question stem. Okay, so you know the demographic and the symptoms. Maybe you figured out the diagnosis in the question already. Maybe they gave it to you. I don't know. But you figure out the diagnosis and then the diagnostic criteria. You know, did they have this test run, whatever? Is this test positive and this test negative? Like letting you know that it's this disease versus this disease. Go through the pathophys of that. So I know we all hate it, but if you have to go through the entire collagen synthesis to figure out that this patient has Menkes and then just review that entire, pathway, then that's fine, because this is the way that you take your questions for learning. And then, is there any involved histology or pathology slides? Did they give you a slide? Did they not? Are we talking about, pemphigus vulgaris? Okay, well, they didn't give me a slide or anything on the question, but I want to go back and I want to review the histology of normal skin. And then I want to look at that histology and figure out, okay, what would be wrong if this was pemphigus vulgaris or bullous pemphigoid, okay? So now we've gone through pretty much like biochem, molecular biology, histology, pathology. What are we missing? Well, pharm, right? Our favorite subject ever. It is actually one of my favorites. So you figure out, okay, this patient in front of me, this 65-year-old man with, pemphigus vulgaris or whatever, what is the treatment for this disease? If there's not a treatment in first aid, that's fine. Sometimes, we don't have the treatment right in front of us, but say it's something that, like a microbug, and they're like, oh, okay, we're going to give Vanco. You figure out that treatment, why that's the treatment that you would pick. If there's any alternatives, you need to look up the mechanism of action of that treatment and the side effects. And so for pharm, that's usually when I pull out my sketchy pharm book, and I've actually gone through every single one and on the pictures drawn out what every single picture means. And that really helped me a lot because I don't have to reread or I don't have to rewatch the videos. I've watched them all already, and I've gone through and I've annotated the picture itself. And so that helps really like stick in my brain a little bit better as far as like the sketchy, micro, or pharm. And so when you go through a question like this, you can understand how doing 40 questions would take you a really long time. This should take you probably like 20 minutes to figure out all of this shit for this patient. And when you do this, you're kind of thinking more of a puzzle. How does this patient fit with this question? What would happen if I was a resident and this was in front of me? Like, think of it more that way, and it seems to stick in my head at least a little bit better than when you're just reading a stupid question. And so when you're doing the questions to practice for step 1, this is how I usually do questions. I will do some for studying every day and then some for practice. And when you're doing the practice ones, yes, you have to like time yourself. But first, I always go through the question first and then go back to the stem. So, okay, it's asking me, what is the mechanism of action of the drug of choice here? Okay, well, I need to figure out the diagnosis, the drug, and then the mechanism of action. So you kind of can map in your head what you're going to need to do. Obviously, highlight what's important. I don't think I have to tell you guys that. Try to recall any mnemonics or videos about the subject. This is why I started this YouTube channel, was because I'd come up with a lot of mnemonics and ways to memorize things. And I felt like I had to share them because there's so many times where they're just like, oh, well, I just read this book and I got a 260. Like, I just read first aid once and I got 260. Like, that's not how normal people learn. So, You have to think of ways to study smarter, not harder, right? How am I going to be able to, in the stress of the test, you've been there for 6 hours, how am I going to memorize this stuff? Is there a dumb way I can recall this to bring up this information? Read every answer choice. I put this in bold because this is the worst one. I had to have a sticky note on my bulletin board behind my computer that said read every answer choice every single time, because I would pick an answer choice, not look at anything else, and hit next, and I would not have even read the answer choice that was the right one. And I think this partially could be my ADHD, it could be something else, I don't know, but read every answer choice. For every answer, come up with what is the patient that this answer choice would be talking about. And I know this sounds like a lot, that you can't do all of this in a minute and a half, but if you practice it, you can get really fast at it. So you'll look at that answer choice, you'll say, this is what this patient would look like, this does not fit my answer, or in my STEM, next. I did this on every question on step 1, and I'm telling you, it helps. And if you're stuck between 2 answers, that's okay. The amount of times that people were like, oh, well, I was stuck between 2 and I always picked the wrong one. I'm the same way, okay? I think everybody in the world's the same way. So if you're stuck between 2 answers, that's okay, because that means that you've gotten down to the 2 that step is trying to trick you on. Okay, that means that you're smart enough to figure out that there's 2 there. So when you take those 2 answer choices, you've crossed out everything else, you take a step back and you're like, does this fit my patient? Go back to the demographics, go back to the symptoms, because usually that will help you. I'm stuck between 2 answer choices, but this one's most likely in men and this one's most likely in females. My patient's a male. Let's go with this one, okay? Look at the symptoms. Well, this one would give me this symptom and this one would give me another. And it's hard, and I know it's so hard because I failed step once and I understand where you're at. But this will help you so much if you can take that step back and think, does this fit my patient? Because so many times we get stuck in our pathophys process or our histology picture and we're like, well, shit, there's 2 that I think could be right. Take that step back. Think, is this a real patient in front of me? Okay? So let's look at a question just really quick. I think this is an NBME question that I've had in the past. So first, we're going to read the question, right? The most likely cause of the finding is a primary carcinoma of which of the following, okay? A primary carcinoma. This patient has cancer. Let's go read the question. A 50-year-old woman has azotemia. Renal ultrasound shows bilateral hydroureters and hydronephrosis. Again, the most likely cause of these findings is a primary carcinoma of which of the following. Okay, so we have something with bilateral hydroureters and hydronephrosis, and we're thinking cancer. This is a woman, so my brain's already starting to think, okay, I want to lean towards something reproductive, right? But let's look at all of these answer choices. Colon cancer. Okay, do we think colon cancer can cause bilateral hydronephrosis? Well, this question's asking, we have a primary carcinoma where that would spread to cause bilateral hydronephrosis, okay? So this could maybe be a local thing. This could be, how does this carcinoma spread? Is it through blood or lymph or local? Looking for colon cancer, and she has azotemia and some ureter things. Well, we know colon cancer would be more like a patient would have maybe like bleeding in their rectum. That's like the key if you have, especially like an older male or a postmenopausal female that has bleeding or they're anemic. The first thing you want to think is maybe a colon bleed or colon cancer. But they would definitely have something else going on, right? Some other symptoms. And as far as I know, that it doesn't, colon cancer doesn't really spread through to the ureters and cause hydronephrosis. So in my head, I'm kind of thinking, no, not that. Kidney cancer. So would a primary carcinoma of the kidney cause bilateral hydronephrosis? Well, I would actually get rid of anything that was renal related just because this is bilateral, okay? if you have a, say, renal cell carcinoma, it would probably be on one kidney and not both. So we're looking for a primary carcinoma. And the way I always think of it, if it's primary, that's where it started, right? That'll be in one place. If it's bilateral or in multiple places, that's going to be a metastasis. So that would be the secondary. So if we're talking about ureters, hydronephrosis, I would get rid of both kidney and ureter. So again, I'm thinking 50-year-old woman, where ovary and uterine cervix. Which one of these is it? And I remember when I got this question, I was between those two. I'm thinking, okay, is it an ovary or is it the cervix that's causing this woman to have bilateral hydronephrosis and azotemia? Well, what kind of symptoms would we have with both, right? Ovarian cancer versus cervical cancer. I can think about cervical cancer and I can think about women who get HPV and then they get cervical cancer, and a lot of the times they don't have symptoms. Ovarian cancer would probably have some type of hormonal symptoms going on, right? And so even though I'm not really sure, like I'm thinking, oh, this is probably in first aid and I probably read it 1,000 times and I just don't fucking know, right? But I'm going to think of it that way. I'm going to think, okay, ovarian cancer, she's not giving me anything hormonal. They're not telling me she's having like maybe an increase in testosterone causing facial hair, nothing like that. But I know that when you have HPV and you get cervical cancer, they usually don't have many symptoms, because that's why we have the vaccine, right? It's a thing that we do pap smears for every year, because women just don't know that they have it. So I'm gonna guess the cervix, which is the right answer. But did you get it wrong? That's fine. That is so fine, because we are in the study stage, we're in the learning stage. Let's go look it up. Cervical cancer versus ovarian, that's what we were between, right? So I'm looking at the cervical cancer. It does talk about pap smears detecting cervical dysplasia. You diagnose it with a coloscopy and biopsy. And yes, in first aid, crap, it was there. There's a lateral invasion that can block ureters, hydronephrosis, and renal failure. And when I'm reading this, I'm not going to read it to you, but I would go through, I'd make sure I know all about like SIN 1, SIN 2, E6 to TP53. Make sure I review this picture of this coilocyte, and especially risk factors, like knowing having multiple sex partners is the number one risk factor. Sometimes demographics can really get you an answer right. And then I look at ovarian neoplasms, and what would they show? Well, I was thinking some type of like hormonal thing. Oh no, I was wrong, right? It presents with an adnexal mass, abdominal distension, bowel obstruction, and pleural effusion. And then maybe in my head I'm thinking, oh, bowel obstruction, maybe I want to go and review colon cancer next. But make sure you go through, while you're studying these things, all of the different, the demographics, the symptoms they would have, the pathophys, all of these things. So it might take you all day to do 40 or 50 questions, but you will know this stuff in the end, right? Lastly, if you can, this is one that really helped me. I got a study buddy. It doesn't have to be somebody who's studying for step 1 as well. It can be just, a parent, a friend, whoever's around. If they can read, they can help you study, right? And I'm not saying like sitting there and, have them read first aid to you or something. One thing that my friend and I did was we would have each other on Zoom in the background and wouldn't even talk to each other. And that was just motivation for me to keep studying. And we would call each other out, and I would unmute myself and I'd say, get off your phone. And she would unmute herself and be like, why are you eating again? So like having that support, even if you're not in person because of COVID, helps a lot for your mental health. And then also having a list of concepts you missed. So say you missed that question we just went through. Okay, well, I have a list of concepts of cervical cancer versus ovarian cancer versus colon cancer. And even if this person is not studying for STEP, you have that list, you give it to them, and they ask you, okay, tell me who would be the person with cervical cancer, who would be the person with ovarian cancer, what are the symptoms, what does it look like, all those things. Have them ask you that 2 or 3 days after you got the question wrong, and then maybe like a week or two later. And that way, not only you're reviewing it in a couple of days, but say if you do it again in 2 weeks, what if you forgot it? You have to keep recalling those concepts that keep coming up, okay? And have a running list of concepts you've missed. And what I would do with my friend was we would review it 2 or 3 days after we got it wrong. We would do it a week or two after we got it wrong. If we kept getting it wrong, we like highlighted it, we put it in red, we bolded it, whatever. And then we had to go through and like recite those to ourselves for like a couple of days in a row. And then we would also have, that color coding system on a list. So if it's in red, we knew we had fucked that question up multiple times. So when we have this running list of concepts, review it maybe a week before the exam. If you're disciplined, sometimes I would read it right before bed, and don't read it passively. Be like, see the top and see, okay, cervical cancer. Put the paper down out loud, all the things you can think about cervical cancer, then read it, okay? That way we're activating that part of our brain for recall versus just passively reading things. And again, RuPaul, good luck and don't fuck it up. I know it's easier said than done now, but you can do this. If I can do it, you can do it. I know this sucks. Reach out to me if you need some help with this. I understand that this process is literally a beast, but in the end, if you keep going, if you spin this story as, I took this failure that I've never had before and I, really tried hard and I tried to use this as an opportunity to become a better doctor. I can't speak for residency applications, but I can speak to human nature, and people like it when you take an adverse event in your life and you work through it versus, I got sad and then I just like studied or something. Like, no, you can do this. If you couldn't have done this, you wouldn't have made it through your first 2 years of medical school, okay? So hopefully this helped you guys. I know this isn't a mnemonic. This is more of a motivational video. And yeah, if you guys need anything, please like, comment, subscribe to my channel. You can message me on Reddit, whatever you guys need. Good luck out there, guys, and don't fuck it up.